I'm Jenny Hunt. I'm the lead professional nurse advocate at Doncaster and Bassett Law Teaching Hospitals Foundation Trust. I came into role in January 2022 on a secondment, and it was on the background of I've had an extensive nursing career, 26-year nursing career in really acute sectors, lastly in critical care. During the pandemic, I took on a role of staff wellbeing because for myself, I had to shield. So that was a natural thing that I could still support my team whilst not being allowed to be physically at work. And the PNA course came up sort of at year one, really, when I was having to shield again. And I thought, I'm offering support to staff, but actually don't know that I'm doing it in the right and the most productive and most effective way. So that's what drew me to the PNA course. Once I'd undertaken the course, I felt completely empowered and really had a greater understanding of the sort of support that staff and colleagues need. So when the position of the seconded PNA lead came up, I grasped at the opportunity, and I've got to say it's the best thing I've ever done, to be honest. So it really aligns to our trust values and our trust vision, and our trust is really committed to supporting the health and well-being of our colleagues, and I've really developed a passion to do that since doing the PNA course, and I just want our colleagues to feel they can develop, belong and thrive in this organisation. So from an implementation point of view, we have an implementation strategy that we've developed, and that will support us to achieve our 1 in 20 ratio by hopefully 2025. We will need approximately 90 PNAs to achieve that. We've actually secured funding for 4 hours protected time per month for our sessional PNAs. That's in a staged approach. So as a PNA in an area qualifies, that 4 hours funding gets released. We really used the equip model to build the strategy and the business case, focused on creating a recruitment strategy, and really a big focus on leadership and collaboration to support the development of the PNA implementation. We've ensured, as I said earlier, that our implementation is closely aligned to our strategic direction, trust, vision and values, and obviously the national guidance that's out there. We are building the team. We're currently a team of 28 with a further to commence their training in the next cohorts. And then we've got a further 10 on the waiting list for the cohorts. And I'm continually creating that waiting list. So as cohorts get released, we can recruit onto there. We have got an evaluation process, and this is supported by our QI team. And as the team grows, we're using that experience and expertise to empower our PNAs to continually improve our PNA service. We're evaluating both the supervisee and the PNA experience. It was really important because this is a new role, and when I came into position, there was limited guidance on how a PNA needed to practice. And actually, I wanted to build a team that were confident in deploying the equip model and confident in their PNA roles. So I've explored what the PNAs wanted. Did they want any further training, particularly around QI, mental health awareness, and career conversations, and we've kind of built that into the implementation. Our activity from an impact point of view is increasing month on month, and we're seeing increased referrals into the service. The PNAs are feeling more confident in their practice, and actually they're empowered to develop their role in their own areas, because each area is going to be unique and might just need to use the PNA in a different way to other areas. From a supervisee point of view, and I think this is really valuable for us, is that we are seeing a reduction in stress and anxiety post-session. So one of our questions is, how stressed were you prior to the session, during the session, immediately after the session, and 24 hours post-session? And some sort of our latest figures, about 20% were reporting that they had severe anxiety prior to the sessions, and there were no reports of severe anxiety post-sessions. Still some levels of anxiety, but definitely reducing. Everybody that's evaluated for us has said that they've benefited from the session and that would recommend the service to others. And really the key themes that we're getting out and what it provides to our supervisees is that it gives a safe place to discuss those emotions and feelings. It supports their well-being. As I said, it reduces the stress levels. It makes them feel valued by the organisation, which is really important to us. and supports development of resilience and supports that professional development. And we're also demonstrating that we can have the potential to reduce sickness levels, specifically related to stress and anxiety. One of the questions that we ask on our evaluation is, has it made you feel differently about staying at work and not going off sick? And currently we're running at about 10% that are saying that has made a difference to them. So really, really big impacts. And I think for me, sort of, when I go out and about and promote the PNA role, it's about people knowing that we're here as a service, and knowing that they can access us. I think that gives them that sense of belonging that they want as well. We've really focused on building the team, and what we didn't focus on, obviously we nationally we've got the number of 1 in 20 ratio. It's actually, for me, it's important how we achieve that. We probably could recruit lots. We could recruit our 86 PNAs sort of, you know, in a short period of time, but it's about ensuring that we've got the right people in the right places doing the right things. A focus very much has been on gaining the protected time for the PNAs, as the role isn't, it's funded from a course point of view, but obviously we need to explore funding options once we get into role. And our trust have been really on board with that. And as I say, we've got the 4 hours protected time for our sessional PNAs. And now we're just working to see what that 4 hours looks like. We need to be adaptable with that as well. We don't want to necessarily say, right, you've got 4 hours on this day to do X, Y, and Z. It might be that we're quite sort of flexible with how we look at that. It might be that somebody has a PNA day every other month, and it's working with their teams and empowering my PNAs to work with their teams to see exactly what's going to fit for them. We've got multiple work streams and sort of had created priority areas while we're still a small service. What the service looks like now isn't necessarily what the service is going to look like in 2 years' time. And I think we need to be quite relaxed about that and accept that we are a growing service, and hopefully that will make it a sustainable service. We're beginning, right from the beginning, we've worked with the preceptorship programme, have really close links with our preceptorship lead here. And now we are establishing restorative supervision sessions within the preceptorship programme. So we're starting to do group sessions with all the preceptees, and that will continue sort of through their preceptorship. Collaborate with multiple teams internally and externally. So we've created some community of practices locally, which are really supportive of that sharing of practice, which is really, really important. I work closely with our PMAs and our Freedom to Speak Up team, our patient safety team, health and wellbeing team, the education team and occupational health. That allows referrals in and out. It supports us in 2 ways, in that we can get those referrals in, publicise our service, but also we can support them and signpost into them as well. We do need to be responsive to all of our colleagues within the organisation, and it is really important for us to carry on continuing to get that feedback, and I say be really adaptable and be open to new ideas, and when things don't work, try something different, but don't be challenged by that. And I think our approach really is supporting that collaborative approach across the organisation, that we just become embedded in practice. When I first pitched to board in July, really outlined the benefits that we were seeing and the benefits of restorative supervision, and framed the implementation within the A-Equip model, which really supported their understanding of what we needed to do. Obviously, it is outlined in the NHS standard contract, and so obviously that was built into the business case. I worked really closely with our finance team and our senior nursing team to develop the business plan, and it was really about what we had a blue sky thinking what we would want, which would be a team of substantive PNAs, but actually paring that back and looking at the reality of what have we got now and what do we need to work with, and so we've done a staged implementation of that funded time. As I say, the funding gets released as a PNA qualifies, so again the business case is planned sort of over 3 years for us to build this service. I think it's definitely that continued evaluation, having that robust recruitment process and keeping the interest of the PNAs, and again demonstrating what our PNAs are doing in practice. I think this will be the focus of the next 6 months, is actually showing what our sessional PNAs can do to make it a really attractive option for the trust, if that makes sense. I think it is really important that we have a support structure in place for our trainee PNAs. And as I said, the guidance initially, it was what is a PNA role. So we've produced some practice principles, which we've worked at a regional level to create. I've also created a role descriptor here, sort of more specific for our sessional PNAs. That's been circulated with our ward managers and the senior leadership team. So people understand the PNA role. Again, it goes back to that collaborative approach, those community of practices, and just keep banging that drum about how good this service is and how effective it can be. We've focused really on the whole of the A-Equip model. I think we have seen that sometimes we focus just on the restorative element of it, but we've got a whole lovely model that we can use that we can utilize in so many different situations. And yes, they're all interlinked, all elements are interlinked, but sometimes we can pull those areas sort of apart. We've created some ambassadors or in the process of creating some ambassadors here because some of my PNAs are very honest and say they're not confident in RCS, but actually have strengths in other areas. And I think it's important that we utilise those strengths. So we've got ambassadors for QI, for career conversations, and they can sort of support the PNA team. So they're sort of go-to people if people are struggling with certain elements. Also support the trainee PNAs, but also as a PNA team gives us a good signposting system in so that we're playing to all of our PNA strengths. As I said, we've outlined our vision and approach to the board, and we report to those monthly, and I think that's incredibly important, and then absolutely carry on that evaluation and show our value and demonstrate our value. I think so. And I think when we put that question, and it's often a question I put in my sessions, what can you change, or what would perfect look like? And obviously it does take a bit of reflection for them to think about that, but actually empowering them to think about, well, how can we change this? And what can I do? And being that sounding board, I think is really important. I think people have lots of ideas, but actually just need to sit down and talk it through with somebody. We found that really beneficial. And anybody that's doing a QI, we've got a really strong QI team within DBTH. Obviously, as PNAs, we can signpost in, but again, as PNAs, we're working collaboratively with them. And actually, the whole PNA implementation has been registered as a QI project, which is really, really supporting the process and really supports our confidence with the QI process because we're going through that process ourselves. I think it's about building those solid foundations, just having that vision, creating that business case, and devising that implementation strategy over how, and don't be frightened, as I said, if that's a protracted time, that's absolutely fine. It doesn't matter how long it takes if you're building those solid foundations. And I think we've kind of proved that with gaining our funding. It would have been really nice to come into role, and yes, the funding's there. It wasn't. So let's explore ways that we can do that, and don't be frightened to explore those ways. And as I said, if one approach doesn't work, change your tack, do something different, and see if that works. You know, it is a new and emerging role, and I think that should empower us. It is employer-led, so we can create something that's meaningful to our own organisations. And I think that's really, really important. And I think engage and empower the workforce and your PNA team to make those changes, because it's those guys that are going to be telling us that we need the service. And just ensure that your knockbacks, you don't view them negatively. We're on a continuous learning path here. And that's exactly what the A-Equip model is telling us to do. So just embrace that A-Equip model and use it to support your implementation.